Hi everyone, we're just going to wait another minute or two just to ensure everyone has joined the session, and then we will begin. Okay, we'll make a start now then. So welcome everyone to the Public Realm Innovation Open Call webinar. My name is Alex Lamley. I am an innovation funding consultant here at the Connected Places Catapult, and I'm going to be leading this webinar. Just to introduce my colleagues on the call. So from the Connected Places Catapult, we have Poppy Driver, Clemence Martin Beaumont, Ryan Emmett, and Gaith Nassar. We will be explaining various aspects of the program to you alongside our colleagues from the River Riding Health Consortium, Heather Macy from Makawa Architects, and Louise Phillips from NHS North East London. Next slide, please. So just a bit of housekeeping to start off. There is a Q&A function in Zoom, so we do have time for a Q&A at the end. So if you have any questions that you'd like to pop in there, please feel free to do so. We do also have the chat function open as well if you want to make any comments that the team will see, or if you maybe want to make any connections during the call for any potential consortium partnerships. Please note that the webinar is being recorded and access will be made available on our website from next week. If you need any other support or want to reach out to us to ask any questions, the team are available for support, clarifications, or additional information that you might need. And we'll be adding the email address into the chat at the end of the call, just so everyone has access to it. Next slide, please. So a quick run through from the agenda. So it'll be me and Poppy conducting the welcome and a bit of an introduction. Then we'll have Heather from Makawa providing an introduction to the river roading sites. Louise will then give an overview of the local community and health. Gaith will then go over the challenge for this open call that you'll be applying to tackle. And then my colleagues Clemence and Ryan will be going over what to expect when you're doing a trial, what to consider, and how to monitor your impact. Finally, myself and Poppy will go over the application and finance information just to make sure that you know exactly how to apply and how the financing works for this program. And again, if you have any questions, please do pop them in the Q&A for any of these sections. So I'll just hand over to my colleague Poppy just to cover the next few slides, covering a bit of an introduction into the open call.
Brilliant. Thanks so much, Alex. So we can go to the next slide, please. So welcome, everyone. I'm really excited to be launching this opportunity with you for the Public Realm Innovation Lab. CPC launched this lab very recently, and the focus is really on supporting innovation within public spaces. We really want to create places that are more inclusive, sustainable, and commercially successful. And, we believe that high quality public spaces drives economic growth, it improves well-being, it strengthens climate resilience. It also attracts investments, increases property values, and delivers social benefit. But we really feel that the potential remains untapped, which is why we've launched this open call. Next slide, please. So we did some preliminary research last year and found that there are three main challenges for public realm schemes. Number one, there's limited evidence to quantify social environment outcomes to guide investment. There's fragmented policies that create delays and inconsistent results. And there's insufficient community engagement that limits trust and influence. So because of these challenges, we created the lab and we're offering three main things. CPC, the Catapult wants to become an innovation broker. So we want to connect local authorities, landowners, developers, community and organizations to SMEs and to innovations to co-create solutions. We really believe in test and learn. So through this open call, we want to support the piloting of ideas in real world public spaces to really see what works and then to reiterate on that learning. We also want to become an evidence generator. We want to produce actionable insights on social, health, economic, and environmental outcomes to help guide policy, investment, and design decisions. So that's why we launched this lab today. Next slide, please. So under the lab, we have various projects, and this project is tied to the River Roding Health Corridor, who we're partnering with. And it's such a fantastic consortium to be partnering with. They've got a huge, diverse range of skills and experience, which has helped shape this open call. So we're partnering with Arup, Be First, Care City, Makara Architects, and NHS North East London. And if you get selected to be part of this programme, you'll be able to work closely with them to help you with your solution design. So thanks so much. I'll be passing now over to Heather Macy, who'll be talking through the consortium and the test sites. Thanks.
Thanks, Poppy. Great. So if we could just go to the first slide, please. Great. Yeah, so I'm Heather Macy, Director at Makara Architects, who formed the River Roding Health Corridor Consortium. So you can see on the left-hand side, that gives you an overview of our team. So obviously Makara Architects covering master planning and place design. We've got just going for, and you can see the kind of titles along the top, going from left to right. We've got a partnership with the NHS North East London with Louise Phillips, also on this call. Be First, and with Anna Gibbs, but wider team at Care City, and Arup. So ultimately, the River Roding Health Corridor Consortium was formed around specifically a piece of river, which we'll talk about shortly, to look at how essentially the River Roding could be transformed into a thriving, resilient and inclusive place. So ultimately our kind of vision is to create a thriving, resilient River Roding corridor where people, communities and nature flourish together, shaping inclusive, health promoting public spaces, fostering social connection and stewardship, and demonstrating how coordinated innovation and design can drive sustainable regeneration and well-being for all. So ultimately in that space between kind of innovation, but actually able to be propositional to kind of test ideas, really. So we have 5 aims, really, which are kind of emerging as well, which is champion community leadership, create health promoting climate resilient environments, develop an inclusive living neighbourhood, that's really important, and leveraging funding and driving innovation, and informing policy and best practice. So, you know, there is a sales stream, which I'll talk about more shortly. Should we go on to the next slide, please? So for the purpose of this, 3 sites have been identified, and that's very much in close collaboration with Be First along the river, all quite different but connected. And if we go to the next slide, and while I talk about these sites, it's important to think about them sort of collectively but individually, and that sort of macro versus micro in any solution that might come forward. So the River Roding is this amazing asset in the heart of Barking. You know, there's not many examples of this level of nature adjacent so close to a kind of town centre. You can sort of see from the top image to the bottom image the sort of opportunities and constraints, let's say. But, you know, there is a real opportunity here to look at kind of community health alongside nature, and think about how, you know, our cities could be kind of serving us better through the sort of lens of this site, in direct relation to kind of health outcomes. Next, please. So yeah, here you can see the health corridor as identified, which is quite an extensive site. And then along the top, you can see the sites that we looked at alongside Be First, all of which are, well, most are Be First ownership, some are kind of private clients, but the ones that are kind of highlighted in green are the sites. So you, and I'll talk through them shortly. But as I said at the beginning, it's really looking at this piece of river, like really considering the kind of level of fragmentation, but also potential in that, in terms of joined up connectedness. And it's an important thing to know that ultimately, I think it's something like, I won't get the statistic right, but it's over 50% of Barking do not know the river exists. So even though the site boundary here is showing, you know, the stretch of river, and that very much is the focus, but just thinking of that in a kind of wider context in terms of health benefits beyond. So as I said, 3 sites, Harts Lane, Viewing Platform, Mill Court, purposely at kind of each end of the river to look at that collectively. When looking at this, you know, as it sort of says on the slide, you can look at the single site or collective sites, but in any proposition, really do look at that, even if it is one site, to not kind of turn your back on the wider context. Next, please. Harts Lane. So starting at Harts Lane. So this is an estate which sits next to the River Roding, and you can see the kind of site boundary doesn't necessarily demonstrate ownership, but it is purposely drawn sort of slightly wider than that to show that, you know, with any of these sites, you really do have to think of the connectivity to it as well. But this is somewhere which is a site which is earmarked for regeneration. So in terms of a typology, like really key. It's got kind of green space in the foreground, which is in front of the river. In reality, when you're standing there, despite the fact you're aware the river is there, you know, there's fences, there's severance, so you don't necessarily get that benefit. There is already kind of parks and things in place, and obviously there is a community here who could benefit from any intervention. It's the yellow line obviously goes over the bridge as well. So in the foreground, you've got the sort of estate, the hard surface, that sort of thing. In the very foreground of the image, you can see the reed beds, and they are one example of basically what the whole of London's rivers would have, or majority would have had historically. And so for that reason, like really important example of particular ecological environment. And then to the right of the bridge, actually, if we go into the next slide, it might be easier to talk to. Yeah, so you can see, you know, there's a real opportunity here in terms of no vehicular access, an opportunity to really like engage with nature, but also you have riverboat communities. So where you see number 1 and number 2, people living there, and there's, as you traverse the river, there's lots of different examples of that. And any intervention should really think about, you know, the river is kind of at this intersection between lots of different spaces and how they come together, and how that could be used to kind of serve health. So yeah, if we move to the next one. I think what I should have said, sorry, at the beginning before we jumped into the sites is an important, and I think Louise will cover this more thoroughly, but where we started with this proposition was really thinking like, how can the public realm essentially make people's lives healthier? And that's not just kind of qualitative, but also quantitative. So so any proposition that comes forward should really sort of challenge that, like not just is the community happier, obviously that's key, but also what are the actual sort of health benefits of this intervention sort of longer term. So we're now in the middle site, which is you know, again, each of these sites show a crossing point, which is also important in terms of traversing the river kind of east to west. But the viewing platform is actually sort of at the top of the image, and you can see there, and then bottom left-hand side shows kind of what that looks and feels like. So very hard surface, but an amazing opportunity because you've got kind of views running lengthways along the river in both directions. So you can kind of, the fact you can sort of stand there and experience that is quite amazing. And then to the other side of the site, you can see the kind of area of green, which at the moment is sort of fenced off. And again, as I said, these aren't necessarily ownership boundaries, but it is just saying like any site should be looked at holistically. So, you know, and this is one of maybe 3 opportunities along the river area identified where the river actually, the site actually does go down to the river. The majority is quite hard surface, sheet piled walls, with quite a big level of separation. So that is something to think about. Also the road running through the middle and the sort of future plans for that as being much more pedestrian focused. So the connectivity across the site is also worth thinking about. But currently very underused, could be amazing. Although cars come through there, it's quite infrequent. And I think with all of these crossings, like that sort of pedestrian experience is quite harsh. So really thinking about not just the kind of nature, but also kind of rubbish and light, like everything, in terms of making this somewhere that people actually want to walk. So you can also see the image like just below, which says access to viewing garden, which shows for that sort of garden space, potential garden space, the sort of access in as it currently stands. If we go to the next slide, and shout if I'm taking too long, everyone. We'll skip this one, go to the next one. Yeah, so this is just a kind of simplified version. So haven't really talked about the heritage of Town Quay Wharf. So number 5 being the granary building, but the quay itself is a really important historic piece of barking, and obviously the viewing platform having that kind of privileged view across it. The site is quite windy at the moment. Obviously, any of these sort of river crossing sites have that challenge that's really worth thinking about. But in terms of ecological opportunity, as I said, number 6 shows that sort of the landscape running down, and just mirrored to that, just behind 1 and just to the below 3 is areas which actually have been established by the River Roading Trust of like new greenery. So it is just showing that kind of natural man-made, like how it all comes together. And I think this is quite a good example of that. And beyond the site itself, obviously connecting on both sides, thinking about the park and wider community is obviously key. We go to the next one. And coming further east along the river, we've got the Barking Barrage, and again you can see the barrage itself. If you look at the image on the far right, is the sort of crossing point. The yellow line is wider than that because it's Mill Court is also included. So top left of the of the yellow line is Mill Court, and the barrage is in the middle, and then you can see the line extends like downwards to that sort of green area, which potentially, you know, they're at the moment not feeling particularly connected, and there are sort of public realm interventions there, but not potentially well used. So just really thinking about how that might all join up and, you know, beyond kind of encourage that access to the river front generally. If we go to the next one, the other thing to say is that the Canoe Club is situated adjacent to this, and you can see where you see the sort of number that we should have put a number on there, apologies for that. But where you see sort of number 1 and come down the page, you can kind of see there's a walkway going down to the riverfront. There's actually one on both sides. Again, another example of where actually from the edge of the river you can get down to the river. So that's, and obviously the sort of community activation of that canoe club and how all of that works, and the barrage itself being something which obviously in terms of education, which you should think about across all sites, offers a kind of immediate draw and link to that river and understanding that river environment more intensely. And again, like all of the bridge crossings, you've got communities on all sides. Why might they come here? And, you know, to the town centre, obviously, wider question as well. Yeah, I think let's move on. I think that's the last slide. Great. Yeah. And so I'll hand over to Louise, who can talk a lot more about kind of the health overlay and benefits.
Thanks, Heather. Hi, everybody. I'm Louise Phillips. I'm the Deputy Director of Regeneration and Infrastructure at NHS North East London. Next slide, please. Many thanks. So essentially, one of the things that we're really curious about and interested about is how, for example, this opportunity can support children and young people achieve a healthy weight. So there's lots of statistics in our presentation that is available in terms of the health outcomes, particularly for children and young people in Barking and Dagenham. And this opportunity presents the sites that Heather has outline a number of opportunities for working with the local community to support children and young people. So that's what's particularly interesting about this research challenge. I think one of the things that's really key to us is working directly with the local community. So Barking and Dagenham is a very fast growing borough. It's got some of the highest housing trajectories in the country, which are illustrated by the sites that Heather has set out. So not only have we got a very existing and active community, but we also have new people moving into the area. So the demography is both growing and changing. And one of the things that's really interesting is how do we then knit together all of these various development sites into a thriving and inclusive area, and how can interventions as part of this open core support and align the goals that Poppy outlined at the very beginning. I think that may be my slide. Is there another slide there? No, that's me. Thank you. And over now to Gabe.
Yes, thank you, Louise. Next slide, please. So yeah, I'll be talking to you about the challenge and how did we come up with the challenge that we have. So by now, I think most of you have read our challenge theme, which is helping children and young people achieve a healthy weight by making public spaces more inclusive, inviting, and connected. Next slide, please. So how did we get to that challenge? At CPC, at Connected Places Catapult, we like to get to the challenge by doing a lot of initial research, speaking to the people who would be affected by the work that we're doing, and speaking to the experts who know about the subject as well. So we've gained a lot of insights from our project partners, and as you've seen, we have a wide-ranging consortium with different expertise levels. We've interviewed local stakeholders who know more about the river, know about the area, know about what's going on with the local NHS. And we've also gathered insights from local residents on their experience and perspectives regarding the river and health, working with one of our consortium members, Care City. And then we combined all of that and had a few internal workshops with our consortium members to try and see what do we want to focus on, what sort of work can actually activate the river roading areas to become a healthcare asset and part of the healthcare infrastructure. Next slide, please. So yeah, as I said, our challenge is supporting children and young people to achieve a healthy weight by making public space more inclusive, inviting, and connected. Why did we choose the term healthy weight? That is like healthy weight is a term that was suggested to us by Luis and our NHS colleagues, and that is a term so that it doesn't add any stigma to a certain weight issue. Even though we know that Barking and Dagenham, the major issue is obesity, but there'll be some young people who have lower weight or have other issues with their weight. And it's important not to exclude them from this, and it's important not to stigmatize obesity in the way that we tackle the challenge and the way that we work on this. Next slide, please. So we have put a few points of what we want the solutions to tackle and what we want them to do. And the first one is to integrate public health initiatives and social prescribing into the built environment. And what do we mean by that? We mean that we want something that's not only part of social prescribing, which is an NHS way of prescribing different activities that could promote healthy behaviors, but also have that as preventative. So people who haven't been diagnosed or who haven't gone through the system yet, for it to become basically for the public realm to nudge healthier behaviors within the communities, that they don't even have to go to the NHS, hopefully, and that introduces that stress on the NHS. We want these solutions to be playful, visible, inclusive public spaces. Again, all of that would hopefully nudge and help with that behavioral change of healthy behaving, whether that is active travel, movement, or it's healthy eating habits. So we have different things that we can look at as well. And most importantly, we want to secure the long term. It's not most importantly, they're all as important. But yeah, it's secured the long term sustainability of built environment. We don't want to do an intervention that ends up being vandalized, neglected, or that the community feels that this is not what they need or what they want. So we want to embed whatever we do in the community needs, and we want the community to have stewardship and ownership over it once we're done. Next slide, please. So yeah, these design requirements should be considered, while the ones before we want to see them in any intervention. These ones it would be nice to see them in the interventions that you're proposing, and that is to create a coherent and accessible health corridor along the river roading. So while we're talking about individual sites, as you see, we have 3 sites, and you might want to focus on one of them. We'd like to see something that looks at the 3 sites, or at least looks at how they're connected together, and how they work together as a comprehensive river corridor. we want to foster interdisciplinary collaboration. So it would be good to see how you're bringing together different voices, different experiences, and different expertise to test, shape, and work on the intervention. And lastly, we want to assess impact using community and stakeholder-defined metrics, which links to the one before, is that we want to know what does good look for the community and how does your intervention actually respond to that, and what metrics are the ones that the community really care about. Next slide, please. And I guess that's it for me. I'll hand over to my colleague Ryan now. And Clemence.
Yeah, thank you, guys. So actually, I'll be starting on this part. So next slide, please. Next slide. So nice to meet you. I'm Clemence Martin-Beaumont. I'm a senior consultant in service design at Connected Places Catapult with expertise in testing and trialing. So what do we mean by trial? So our definition is that a trial is when a solution that could be either a product, a service, or a system is tested with end users in real life situations to assess the solution performance, qualities, or suitability as well in this given context. So for instance, you could be trialing features for physical activity within the public space, or active mobility solutions, or some kind of group community activities that could happen as well in this public space. Trials are a great opportunity to de-risk innovation by testing new and ambitious ideas at small scale in real life settings with all the changing parameters going with it. It's about listening to end users by collecting insights and feedback from end users to uncover issues and opportunities that cannot be predicted otherwise. So it's really about learning about the unknown. It's about refining your solution through this process to align more closely with what people need, and in that case, what children and young people aspire to get access to, and in the context of this challenge of healthy weight. And it's about gathering evidence on how to successfully integrate your solution in the public realm to address the challenge of healthy weight for youth and therefore shape and demonstrate a compelling case for scaling this. Next slide, please. So when joining this trial opportunity, we want potential applicants and solution providers to be willing to really learn. Trial is all about learning. So it's about developing and refining your solution to address the selected challenge. It's making sure it matches with people needs, making the space more inclusive, inviting and encouraging people to adopt healthy lifestyle in this context. So we want solution providers to really be ambitious. We want you to be here and testing is about learning. So we want you to test things that you don't know or are not sure about. It's about gathering new evidence on how your solution can perform and integrate in this public realm context and with this youth audience. We want solution providers to be open-minded. So it's all about making discoveries, so gathering unexpected feedback from end users and trial participants, analyzing those and integrate those in your solution developments. And obviously it's about being flexible as well. So when trialing solution in real life settings, there's always surprises on the way. So you have to be able to adapt and pivot quickly, iterating on your trial as well. Next slide, please. So the solutions will be tested in real life settings in one or several of the selected sites along the River Redding, as we mentioned, involving the local residents, such as children, young people, their families, or related groups, such as schools and youth club. So I think this is part of your application, telling us who you want to engage with exactly. The trial period will run between January 5th and March 16th. So it's about approximately 10 weeks, up to 10 weeks. We asked for solution providers to be present on site and run their trial and measure their impacts as well. So you might not, of course, be physically on site on a daily basis for 10 weeks, but it will be key for you to be there for running some key activities such as baseline evaluation, installing your solution, observing end users' behaviors when using your solution, and gathering their feedback, for instance, doing some Vox Pops, user interviews, or focus groups. You will be supported to set up a trial project team, including key partners and Catapult representative, and run a regular cadence of meetings across the trial period to ensure delivery of the trial plan that you're proposing. And we want this process to be really engaging and collaborative, specifically for the local community. As we said, we really value community-led innovation in this process. So we would like solution providers to suggest creative ways to engage with local residents and targeted groups, knowing that the project in itself has to be attractive to be including kids and young people. You'll be involving kids and people, families in adapting your solutions for the trial, refining your trial plans with you, offering them opportunity to test your solution in the real life settings, and gathering feedback from them as well. And so in terms of participant recruitment, engagement, and costs, each solution provider is expected to trial their solution with approximately 12 to 40 participants. I think it all depends on what your solution is about. Ensuring diverse profiles are involved to generate sufficient evidence for impacts. The Connected Places Catapult and Curiosity will be supporting with the recruitment of the relevant profiles of participants for your trials. Participants might come and use your solution in their own time, obviously, but we envision that maybe you'll need to run additional interviews or focus groups or workshops for baselining and for gathering feedbacks for your monitoring and evaluation. And we'll have some incentives guidelines in place on how to reward participants in this process, but we request solution providers to factor these engagement costs in their trial budgets in terms of the funding that Connected Places Catapult is making available to you. Next slide, please. And finally, about the support that we are providing. So the Catapult team, together with the consortium partners that Heather and Louise have introduced, and also local stakeholder groups, will be here to support solution providers throughout the design, deployment, monitoring, and evaluation of their trial within the River Roding Health Corridor. Supporting activities and materials will be offered to solution providers throughout their journey in the program, their trial, and in line with your specific needs as well. So this could include, for instance, but is not limited to trial supports. So you have dedicated trial design training, support, and support around the trial preparation and deployments. You have also access to domain expert knowledge. So obviously we have great partners as part of this consortium with very complementary domain expertise in health planning or stakeholder engagement. So you'll be as well able to hear from them and ask anything to them as well to actually improve and deploy your trial as well. We'll be here as well to help you on how to best engage with the targeted audience. And so we'll provide guidance and best practices to meaningfully engage with children and young people, gathering insightful feedback in real world situations from them, with of course some specific process around safeguarding in that context. And in terms of data privacy and safety, we'll have data experts as well at Connected Places Catapult who are able to support you for responsible data management and ethical use of data. And finally, in terms of monitoring and evaluation, we'll provide support for evaluating the results and impacts of the trial in the public space context and in relation with the selected challenge. And on this topic, I'll just hand over to my colleague Ryan to tell you about measuring impacts.
Thanks, Clemence. Yeah, so just following on from that, just want to provide an overview of trial impacts and just really emphasize that the importance of demonstrating within your trial, your proposal, your trial plan, how your solution and your concept is going to be able to evidence and demonstrate benefits and provide a kind of consistent pathway to delivering long-term impact. So it's really about ensuring that the interventions are meaningful, that they deliver health outcomes, well-being outcomes, and so on, and that is demonstrated in the trial plan and in the proposal. And that's, of course, your trial solution actually directly aligns with the challenge theme and the challenge area. And also important is setting out how that solution might be scaled within the river roading area, how it can be possibly scaled up to being a larger project, but also and possibly transferable to other sites, elsewhere. So that there is a sort of deliverable pathway for doing that. And just to touch on some of the benefits that we've been, in terms of some of the background research going on, some of the potential benefits that a solution may speak to. It may not target all of these things. There may be other types of community and health impacts that you might want to bring out and develop. But of course, there will be some core metrics around things like site footfall, dwell time, overall usage patterns and characteristics of that usage, how it might have achieved, for example, behavior change within the local population, things around how it might have improved the perceptions of safety or feelings of safety in the river roading area, and things around like improving a sense of community. And then, of course, there's, in terms of sort of core behavioral and sort of community perception metrics, but then there's also kind of more focused health impacts around things like the direct health outcomes of users, things around how it might prevent, as Gabe touched on, how we might be promoting things like social prescribing, how it might promote community ownership of local assets or involvement of the community in terms of stewardship or administering public spaces and that kind of thing, how your project might facilitate that. And then sort of some direct physical space elements around how it might improve accessibility to the area, and inclusivity and those sorts of things. And then other sort of aesthetic aspects around how it might have improved the quality of green spaces, public spaces, general access to the river, and possibly even things around like changing land usage or improving local social infrastructure provision. So they're just a kind of a menu of considerations for thinking around, well, what could be the potential impacts, and how might we go about measuring and valuing and evidencing that menu of outcomes and impacts. And this is really sort of about, well, it might be things are what is quantifiable, directly quantifiable, what might be delivered in terms of what is more expressed in terms of qualitatively, what is potentially monetizable that could support a follow-on investment case or a business case, coming back to that scaling up point on transferability point. So they're just sort of things that you might want to sort of bring in to your impact assessment plan. And of course, there's an impact assessment team at CPC on this project, so we are there to support you in terms of framing those impacts and support with the monitoring. Over to you, Alex, for the application.
Thanks so much, Ryan. Okay, so I'm going to cover the application information and finance information. So next slide, please. So there are a couple of key considerations when applying for this open call. Generally speaking, if you want to apply for this opportunity, you must be UK registered, but you can be a public, private, or third sector organisation of SME size. Charities can apply for this opportunity directly. However, you must note that it is pre-commercial funding, so you must be able to receive that funding as a charity in line with your guiding documents and your reason for operating. You can also apply as a partner of a lead organisation, and that may resolve some of those issues and have to have someone else to receive the pre-commercial funding and act as the lead. When you're submitting your application, we would ask that you submit any that are considered novel. Now, when we say novel, we mean either it's a brand new technology or a new solution that hasn't been seen before, but it could be that it's a solution that's maybe used in a different sector to being applied to this, the health sector or public realm activation, or it could be already used in public realm activation, but in a completely different kind of public realm. If you're not sure about that, please do get in touch and we can maybe try and clarify that a bit for you if you're not sure. We would also ask that you demonstrate alignment to the proposed solution to the program, which is obviously achieving a healthy weight amongst children, but that your solution, in order to be eligible for the trial, must be of what we could say TRL 6 or Technology Readiness Level 6. In the application guidance document, we do have a definition of how we classify TRL 6+, so please make sure that you look at that to ensure that your solution matches with that. If you're not sure, please do get in touch. The other two main points that you need to consider is that in applying for this opportunity is that when you're applying with sort of a draft trial plan, which will be finalized between the 1st and the 12th of December, which will involve some site visits, workshops, and that work to create the full trial plan will not be covered by this funding. The contracting will take place after, when we have selected the final candidates. And also there will be a site day on the 3rd of December. It's not to be confirmed, it is confirmed on the 3rd of December. So you will be required to travel to the River Roding at a minimum on that day. Next slide, please. So in terms of the application process, we would ask that on the open call page, you review the application guidance documents, so the application guidance, the open call handbook, terms and conditions, etc. They're available on our website. And we have an opportunity page which is through a platform called Simply Do, where we ask all the questions and you could submit your documentation, that kind of thing. The application form consists of a series of questions about you as a lead applicant, your organization, your partners, a series of due diligence questions, which make sure that you're fit to be part of the program, as well as 8 scored questions, which is where we ask around your trial, your solution, your expected impact, as well as a risk register and a finance plan for how you're looking to spend the money. So on this last point, we say focus on answering the questions. That might sound a bit silly, but what we mean by that is that look through the questions first, see where we're asking for different bits, just to make sure you don't duplicate in different over multiple sections, and that you're very clear when you're answering those particular questions, that you're answering only what we've asked for. We also have our scoring criteria and a bit of guidance in the application guidance document, and that's how we will score your answers. Only what we ask is what's evaluated. So if you go to the next slide, you can see here, this is how we're weighting the scoring. So in the application form, there are 4 different scored sections, which are solution, which has a weight of 30%, trial design and project management, which has a weight of 30%, the impact, which has a weight of 30%, and the team and consortium, which has a weight of 10%. So that's just how you know the level of importance that we place on each of these different scored sections on the application form. Next slide, please. So the funding aspect, which arguably one of the most important aspects of this. So we will be providing this funding as pre-commercial pilot funding. So what that means is that this is funding £25,000 inclusive of VAT if you're VAT registered. And we must clarify that when you are conducting your trial, so this is after the contracted period, so this is in January, only fees and costs incurred during the trial delivery dates are eligible to receive funding. And you can see an overview of that in the application guidance document as well. When we provide the funding to the lead applicant, because it's the lead applicant that receives the funding, if you are a part of a consortium, it's your responsibility to distribute the expenses to your partners and documenting all of the expenses. If it's partner that's incurring the expenses, generally speaking, we would consider that to be subcontracting. And so they can just provide you with an invoice directly rather than an itemized bill. In terms of what we could cover with the funding, so things like personnel costs, staff time, equipment, research and development, prototyping, consultancy and expertise, travel, subsistence, we do cover all of these things. Please do get in touch if you're unsure. Again, there's a bit more guidance in the application guidance document if you're unsure. And just again to reiterate that the trial design stage between the 1st and the 12th of December is not covered by this funding. So if you try and claim anything for that, we will not cover it. Only during the trial delivery dates, which is January to March. Next slide, please. So in terms of the timeline, as I kind of alluded to earlier, so the application closes on the 3rd of November at 10 a.m. We'll then go through a period of assessments through which we'll be inviting successful participants to interviews between the 24th and the 26th of November. From those interviews, we will select a number of participants to take part in the trial design phase stage, which is not covered by the funding, from the 1st to the 12th of December, with a site visit on the 3rd of December, and then the successful we will select up to 4 solution providers, which will be notified on the 15th of December, and then we'll commence with the contracting between the 15th and the 17th of December. So your trial delivery stage, which is where we will start covering the funding, covering the expenses, sorry, is from the 5th of January, which ends then on the 16th of March. Now, it's important to note that the final report is due on the 17th of March, so immediately afterwards. So you should be considering that you need to work on it as you're going along. And then what we will then start making, organizing and making payments between the 16th and the 31st of March. We say allow it up to 30 days from when we approve your payment, just to keep that in mind. Next slide, please. So I'll just hand over to my colleague Poppy, who will just cover this slide on what to expect during the trial design phase.
Thanks so much, Alex. So as Alex said, we will have about 1.5 weeks at the beginning of December where we will have pre-selected up to 6 solutions to go through to this stage. They can develop their trial plan, and then we'll down select up to 4 solutions from that. So this is really exciting stage. This is where you'll get workshops from the Catapult on how to run a successful trial, and also setting good impact metrics. There are a lot of what Clemence and Ryan have spoken about today. We'll then be having a site day on Wednesday, the 3rd of December. This is when you'll get to come to Barking. You'll get to meet the consortium and the partners. You'll get to visit all the sites that you could potentially be trialing on. And this is all about developing your trial design plan to make sure that it really is feasible, and working with some of the members. So BE:FIRST will be there, who will be able to talk through and help you with understanding what permissions would be needed to be able to kind of deploy your trial. So it's really just hashing out to make sure that your trial plan is feasible and really kind of developing it to be really strong. You'll then have independent time for the trial design, and then we'd need your trial plan submissions by 11 a.m. on Wednesday, the 10th of December. A template will be provided to you, and it will be very similar to the one that you're submitting for your application, but just a bit more detailed and developed. It's also really worth noting, we'll be also setting up a session to engage with the local community panel that's been created. The panel will be formed of young people and teenagers, school-aged children, parents of young kids, and health experts. So that'll be a panel of people who are really interested in supporting this initiative, and would love you to meet them during this stage so you could get your trial plan kind of reviewed to get feedback from the local community and the local people who you would be essentially delivering your products to. So thank you so much. Thanks, Alex.
Thank you, Poppy. So we finished pretty much almost bang on time, 1 minute ahead of schedule. So we're just going to move on to the question and answer session. So please feel free to populate your questions either in the Q&A section or into the chat. So I can just see that someone has asked a question around, do we have a list or the names of the place-based organizations and stakeholders that potential applicants could work with?
Yeah, I can answer that one. So at the moment, you'll have access to the consortium, who will be able to support you through your trial. It would be that probably one member would be a link to each trial. Be First is connected to the council there. So in terms of getting site access and deployment, we've kind of got the support there. Obviously, as Heather's gone through, she really understands the site in much detail and will be able to provide you a lot of context there. It's then the community panel that will be there to support you in kind of the understanding of co-designing your solution. And we're also getting support from Care City to make sure that you have some strong access to community links. So your trial participants, you'll get a good cohort of trial participants to run your trial. I hope that's answered your question, but if not, please do add in more questions and I can answer it for you.
So just moving on to the next question. So you've had a question from James. He's asked, why has the TRL system been used to guide applicants? How can successful applicants manufacture or produce physical interventions in limited time? And then he's also asked about the traction section. I'll answer the question about the traction section.
Yeah, I can talk to the TRL section.
Yeah.
So we've said TRL 6+. So you don't have to be at TRL 6. So I definitely recommend you look at the different TRL sections to kind of see where your solution fits. The TRL is linked to the funding requirement. So all this funding comes from Innovate UK. And we must kind of link our funding to a TRL stage because we find that our programs really help people move through the TRL stages. So your question was, how can they manufacture or produce physical intervention in a limited time frame? Well, it depends what your solution is. So if you look at TRL 7, that's about demonstrating the technology in an operational environment. Obviously, TRL 6 is about where a prototype is demonstrated in a relevant environment. If you feel you may have a prototype, then that's fine to be deployed. If you feel then that's not enough time to create a prototype, then I would think that the opportunity wouldn't be for you, I'm afraid.
Yeah, so just in terms of the traction section, so there's two components to this answer. So on the one hand, say you are creating a new service proposition, physical piece of equipment, that kind of thing. It may be that you've already reached out to some potential commercial partners. Maybe you've already been considering doing some sort of trial. So basically, we would just like to get a sense of if you have already started those conversations, if you've already, that's what I mean by traction. If you already had a traction with potentially some sort of partners. It could also be that if this is a solution that's already been deployed in a completely different sector or a completely different market, what has the traction been in those areas before you bring it over into this type of environment? So that's why it's two kind of pronged in a way. So you can look at it from either side, depending on where you're coming from into this project. There's also a question here around a physical prototype of your novel intervention to consult with locals. So typically, due to this being a trial, we would expect that if you are trialing a physical piece of equipment, that you would already have prototypes ready and available to trial as part of this open call. So if you're looking to develop it into something that's ready to be trialable, I don't think, if I'm right, probably this wouldn't be the right opportunity for you. We're looking for something that is ready to be trialed at the start, not to be able to be manufactured or designed throughout the. Obviously, there will be amendments that you may wish to make as part of the trial. That's part of a trial. You make changes, you take learnings, but there will be something at least that you're ready to try. And again, it doesn't have to be physical. It could be software. It could be a new type of service proposition. There's a wide variety of things that we can look to in that sense. And just to expand on another question around what novel solutions really mean to us, because I think it's a bit related. Novel can be, it's a new piece of technology or equipment, or it could be something that's already been deployed and established somewhere else, but hasn't been used in this context or in this market before. And by market, I mean in kind of like the health sector, or community engagement sector. So hopefully that answers those questions. We have a question here, 3 questions here from Sarah. So I'll go through them one at a time. Question 1 is, are partners essential to include, and what do we mean by partners? So in terms of partners, it's not essential to include partners in your application. However, we would expect that you take into account that you may need to work with partners if you need to try your solution. So if you don't have any partners, you would be expected to be able to explain why you don't need partners. And by partners, it can be any organization, essentially charities, local advocacy groups. It could be other companies. It could be local government. Any kind of partner is eligible essentially to work with. It's limited essentially by your imagination and who will work with you. Question 2. Can you elaborate on long-term opportunity and scale in a way that we can be entrepreneurial with it also? I think potentially either Poppy or Clemence, that might be a question for you.
Can you just repeat which one that was, please?
From Sarah Ali, it's question 2. What are the long-term opportunities in scaling in a way that they can be entrepreneurial with it?
Yeah, happy to take it, and maybe Poppy, you'd like to complete as well. So for sure here, the objective is to test your solution and to measure impact on how it works in these contexts with these youth audience as well. And as I said, it's about like shaping a good demonstrable case and business case for you. We're working with the local partners, and this is why we have Be First, who's strongly linked to the local borough as well. We have the NHS and Macawar as well, Arup and Care City, who could help as well or be here to explore routes for scaling afterwards. I don't know, Poppy, if you want to mention anything else with this.
No, I think that kind of covers it mainly. I think this is a real opportunity to kind of develop your solutions and really be able to show how they work in this local context, in this specific site, and with the local community. You'll have great access to the partners who can kind of help develop it. So at the end, you're really demonstrating that your solution is fit for purpose, which I think is a great opportunity for you to develop that.
And we'll be also exploring how, if you do need like it's an opportunity for you to make local links as well, meet other stakeholders, and Connected Places Catapult could support with this as well.
Okay, we don't have any more questions currently.
Alex, there were just some above Sarah's that I saw one that maybe.
Yes, apologies. Sorry that I missed that one from Dr. Orit Gal.
Mhm.
If selected, I understand the payment for costs will only be distributed at the end of the project. In other words, we need to finance it ourselves until then. Just as a startup, this is a bit of a challenge. Thanks. I believe, did we? Yes,
The payment is 60/40.
60/40, yes. So it's not entirely the payment at the end. So it'll be 60% upfront that you'll be receiving, and then it'll be 40% at the end of the program. So you won't have to finance it entirely yourself. But obviously we won't be giving the entirety of the payment until the very end, the final tranche of the payment until the end, on the confirmation that you've achieved kind of the outputs that were outlined at the beginning. And again,
which is essentially, sorry.
Yeah. Which, as is, I think you're about to say, just doing the trial. And just to clarify, this is a learning experience as much as it is a project where we expect certain things. So, it may be at the end of the day that your project may not achieve the results that you expected. It may be different, it may be worse, it may be better. That doesn't mean that you won't be able to get the funding. What we want is to see honestly how your potential solution responds and how it performs in these trial sites. So, what I'm trying to say is, don't worry if there's a bit of risk. Risk is okay in this kind of thing. That's the whole point of a trial, in that sense. Are there any other questions?
Yes, Sarah's just added another question. So can ready to trial mean the tech is already in the market, so we're not creating that, but we're using it creatively differently and applying it differently? Yes, that is correct, Sarah. I mean, you need to make sure that you meet the requirements. So just read the full criteria. But yes, that would be what novel would be. You're applying it in a different way to a different setting. It would be seen to be that you're developing your solution further because you're applying it differently, which is definitely what we're looking for. You also did ask about reports. I've just sent a link in the chat to, at the end of that web page, there are some reports, but also to note in the handbook that you could download from the Open Call web page. In the handbook, there's a link of lots of reports directly linked to the community and health of Barking and Dagenham, which may be really useful as well to just explore, to understand kind of how we got to the challenge of healthy weight for youth and young people.
And I think there is a last question in the Q&A. So you said it makes more sense to work with the partners you've already identified, like local residents groups, River Rotting, Health Corridor Consortium. So is it a matter of including them in the partner section? I would say that you have one specific section and question about who you would like to engage with in terms of local residents. And so, if, for instance, which age group in terms of youth or parents or schools. So you have specific questions for that. And if you have suggestions on how you would like to work with the River Roding Health Consortium, that might be part of your trial plan and trial proposal.
Yeah, so just to clarify, when we say consortium members or members that you're working with, we wouldn't include the River Roding Consortium members. This would be your own organizations that you've decided to work with to achieve your trial goals. So just to clarify, in the scored section, you wouldn't mention the River Roding Health Consortium partners.
You don't need to come with partners for this open call. You can just come in your own organization with your with the thing that you'd like to trial. We're not expecting you to necessarily come with anyone else.
Yeah, as well. So I just meant just if you have any consortium partners, but as Poppy says, totally fine to apply as a single applicant. Okay, I think that's I think we're out of time now anyway. So thank you very much, everyone, for attending. So just to clarify, we will be sending out a post-event email with both the links to apply, the recording of the webinar and the slides. So if anyone wants to look over anything, you will have that available. It should be available in the next day or two, I believe. And yes, I hope everyone has a great rest of the day. And we look forward to seeing your applications for the open call. And thank you very much for your time.